Once it is irritated, it begins to perform peristalsis. Okay? Therefore, you will be able to induce peristalsis or peristaltic movement. Okay? The movement of the intestines and colons, okay, in the GI cavity is your peristalsis. Okay? That's number 3. Number 4 is to be able now to remove the feces. Okay, gas. So these are the actions of an enema. Okay, someone is trying to get in. Allow me to accept. Ms. Ariza. Oh, nandiyan na yung bigas namin, guys. Okay. Purposes of enema, number 1, to relieve constipation. Okay, in catheterization, the purpose of catheterization is to relieve urinary retention. But in enema, our very purpose is to relieve constipation. How would you know that there is constipation? When there is no urge, when there is an urge to defecate, but feces could not get out of the colon. Abdominal distension, okay? Abdominal distension is one also sign of constipation. What else? Abdominal tenderness. There is also a sensation of fullness. There is also a sensation of fullness, di ba? Parang hindi siya mapakali. Eh, gusto kong tumae pero walang lumabas. Walang lumalabas. Okay? That is your constipation. Number 2, to relieve flatulence or the presence of gas. Okay, the presence of gas in the GI tract, particularly in the colon, the presence of gas in the GI colon, in the colon, to administer medications. Okay, to administer medications rectally. Example would be your Dufalac, or your lactulose, Another medication that is given, particularly if a patient has liver cirrhosis, okay? If a patient has liver cirrhosis and there is accumulation of ammonia, liver cirrhosis. Okay? Ano ba ang liver cirrhosis? Ito yung sakit ng mga alcoholics na nagkakaroon sila ng jaundice. Nagiging yellow yung kanilang skin, yung kanilang eyes. Okay, that is liver cirrhosis, guys. And then one of the complications, it is what you call your hepatic coma. One of the complications is your hepatic coma, guys. Complication ito ng liver cirrhosis, hepatic coma. Kung saan, as the name implies, coma. The patient is difficult to awaken. Why? Sobra-sobra kasi ang ammonia doon sa utak ng pasyente. Okay? Para matanggal ang ammonia sa blood ng pasyente, ammonia is in the blood. There is accumulation of ammonia in the blood. And because of the blood-brain barrier, this ammonia could also enter the brain. Okay? And then to be able to relieve that, nagbibigay tayo ng isang medication rectally. Okay? In the form of enema, rectally, yung tinatawag nating neomycin sulfate. Yung tinatawag nating neomycin sulfate. It's a favorite board exam question, guys. Okay? Neomycin sulfate could be administered orally. It could also be administered rectally. Okay, in the case of enema. Okay, and the purpose of your neomycin sulfate is number 1, to reduce ammonia formation. Ammonia formation in the colon. To reduce ammonia formation in the colon, ammonia accumulation in the blood. Okay? So later on, pag nag-4th year kayo, nag-3rd year kayo, mas maiintindihan nyo ito. Okay? Pag nag-3rd year kayo, medical surgical nursing kasi ito. Pag nag-4th year kayo, at ako pa rin ang teacher nyo, may encounter nyo pa rin ito. Okay? To lower body temperature and then to evacuate feces in preparation for a diagnostic procedure or surgery. Okay? So everyone who would undergo abdominal surgeries, okay, reproductive surgeries like total removal of your uterus, lahat po yan mag-e-enema. Okay, lahat yan mag-undergo ng enema. Bakit? To prevent contamination, okay, and infection during and after the procedure. So kailangan malinis ang bowel mo. Kailangan malinis ang colon because any feces there, okay, would be the source of contamination or infection. Okay, these are just purposes of enema, but the major purpose of enema is to be able to relieve constipation. Okay, and another one, to evacuate feces in preparation for a diagnostic procedure or surgery. Okay. Classification of enema, number one is your cleansing enema. Classification of enema, number one, cleansing enema. This is the most popular type of anemia, or cleansing enema. When you say cleansing enema, it's an injection of water-based solution into the rectum or colon with the purpose of removing feces or stool. Okay, the purpose of cleansing enema is to remove feces or stool. Okay, specifically, these are the purposes of your cleansing enema: to prevent the escape of feces during surgery. We do not want any stool or feces during surgery because, as I mentioned a while back, it may cause contamination, cross-contamination, and infection. Number two, to prepare the intestines for certain diagnostic tests. Example would be your lower GI series, your barium enema, which we will discuss later. What diagnostic test also is done? Okay, na kailangan ang cleansing enema, your colonoscopy, your rectosigmoidoscopy. I repeat, colonoscopy, rectosigmoidoscopy. Sige, okay? Madidiscuss nito pag nag-third year kayo. Okay? Or probably sa fundamentals of nursing nyo, na you were able to discuss already colonoscopy. What are the pre-procedure, okay, in colonoscopy? Or even in your case presentations. Some of you may have discussed already what colonoscopy is, but don't worry, you will discuss more of this when you have your medical surgical nursing next year. Okay? And of course, the major purpose of your cleansing enema is to remove feces. What are the types of your cleansing enema? Number one is your high enema. Letter A is your high enema. High, mataas. Okay? This is given to cleanse as much of the colon as possible. Okay? Di ba? There are four parts of your colon, di ba? You have your ascending colon. Okay? You have your ascending colon, yung pataas na yan. Bakit kasi ang late enter ng iba? Dapat lahat kayo naka-enter na by 8:30. Bakit ang late kasi mag-enter ng iba, ha? Ang klase natin ay alas 9. Pag wala pa yung iba ng 9:30, hindi na ako nakaka-disturbo, nakaka-distract, guys. Nawawala yung momentum ko. Kaya nga nag-start tayo ng alas 9 para alas 7 sana nag-enter na kayo sa link. Okay? Hindi na ako mag-a-add. Nawala na naman ako, hindi na ako mag-a-add ng estudyante. Sir, hindi ka na talaga mag-a-add kasi wala ka ng estudyante. Nakaka-enter na kami lahat. Last na si Josiah, I will no longer add students. Okay, nawawala yung aking concentration. Okay, ano ba pinag-uusapan natin? Your high enema. Okay, so this is your, hindi marunong mag-drawing sa Sir Jake. Pasensya na kayo. Kunwari, ganyan. Okay, ayan. This is your ascending colon. This is your ascending colon. This is your transverse. This one is your descending. Pasukin ko nga na yung aso ko, maingay na naman siya. Halika na. Pasok. And this one is your sigmoid. Papunta kay recto. This is your sigmoid. Okay? Here, liquid pa ang stools dito, guys. It is liquid. Okay? This is liquid. This one is mushy. Okay? This one is semi-formed. And this one is hard stools. Okay? Yan. Kailangan mong tandaan to, guys, sa favorite board exam question. Okay, favorite board exam question, particularly with colostomy. Okay, colostomy, okay, dito, may butas dito sa kanyang abdomen para dito lumabas yung kanyang feces. Di ba? Okay, pag-aaralan nyo yan. Sino ang may colostomy? May mga colorectal cancer, ganun. Pag-aaralan nyo yun pag nag-third year kayo, nag-fourth year kayo. Okay? So, importante na malaman mo, anong klaseng stools meron sa colon. In your ascending, basa pa yan, liquid stool yan. In your transverse column, that is mushy. Okay? Descending colon, it's semi-formed. And this one, sigmoid colon, here, okay, here, the feces or stool is very hard. Kaya sa colostomy, kailangan mo mag-irrigate dito. Dito pumapasok yung tinatawag nating colostomy irrigation. Don't worry, you will discuss that in your third year, okay, for your medical surgical nursing. Okay, let's go. The amount of solution for high enema, that is 1,000 ml. That is 1,000 ml. Position changes during administration, okay, from, you have to remember, guys, sa high enema, pinoposition natin yung pasyente natin in different positions. Unlike in your low enema, ang iisa lang ang position niya, it is left lateral only. Pag low enema, left lateral. Pero pag high enema, gusto natin talaga as much as possible, malinisan ang ascending, malinisan ang transverse, you will be able to cleanse your descending, and you will be able to cleanse your sigmoid. So initially, the patient is on left lateral position, okay? And then to dorsal recumbent, and then to right lateral position. From left lateral to dorsal recumbent to right lateral position. I'll just check on you. Guys, may brownout sa Sabado. Okay? 8 to 5. Hindi ko alam kung affected kayo or affected ang CI nyo, pero ako affected ang aking klase on Saturday. Okay? Let's go. We are done with high enema. Ulitin ko lang, the amount of solution, kaya nga high enema kasi mataas yan, as much as the colon. Okay? 18 inches ito above the colon. 18 inches. Ang height nito dapat is 18 inches above the colon. The amount of solution is 1,000 ml. Position changes include initially left lateral, dorsal recumbent, and right lateral position. Why? To be able to cleanse the entire colon as much as possible. Let's go. For your low enema, may picture naman tayo dito. Okay, kaya nga low, we want to cleanse, okay, the sigmoid colon and the rectum only. We want to cleanse the sigmoid colon and the rectum only. Amount of solution, 500 ml. Okay, 500 ml. Pwedeng less than 500 ml yan. Okay, pwedeng less than 500 ml yan. Okay, position, maintains a left lateral position, particularly pag adult yan, left lateral position during administration. Kasi pag pedya yan, pag children, dorsal recumbent ang recommended or ideal position. But for adults, it's left lateral position. Next type of enema, okay, next type of enema is what you call your large volume enema. Large volume. Kanina kasi high enema. Okay? So height ang pinag-uusapan doon, 18 inches. Okay? 18 inches above the colon. Kanina naman low enema, 12 inches lang yon. This one is large volume. So ibig sabihin, yung bulk ng solution, yung dami ng solution, ang importante dito. Bakit? To clean to be able to clean the bowel as much as possible, as much of the colon as possible in preparation for a surgery or a diagnostic procedure. The amount used is 1,000 ml. The height of administration, same as that of your high enema, which is 18 inches. Okay, 18 inches. Yes, 18 inches. Okay? So pag mabilis ako, sabihin nyo lang ako. Large volume enema, the amount of solution administered will depend on the age and medical condition of the individual. Kapag merong sakit sa puso, sa heart ang pasyente, okay? Example, kung meron siyang right-sided heart failure, meron siyang congestive heart failure, okay? Congestive heart failure, okay? Kung meron siyang acute renal failure, yan, alam mo naman ang mga cases, mga diseases na yan. For your renal failure, for your heart failure, there is water retention. There is fluid retention. Okay? There is pulmonary edema. Okay? There is cardiomegaly kasi punong-puno yan, swollen yan. Okay? Because of water retention. May edema ang mga pasyenteng yan, guys. Okay? Meron silang bipedal edema. Meron silang carpal edema. Okay? Mabigat ang mga pasyenteng yan because of fluid retention. Kaya, let's be careful with the administration of your large volume enema. Always look at the patient's chart. Always check the patient's chart. Ano bang case ng pasyente ko? Okay? Renal failure. Hindi na makalabas ang ihi. Merong fluid retention. May edema. Bakit pa ako magbibigay ng large volume enema? Always check your patient's chart. Okay? For example, clients with certain cardiac or renal diseases, okay, it may cause further fluid retention, particularly patients with congestive heart failure, patients with acute and chronic renal failure. Okay, let's go. Large volume enema in children, for children less than 18 months, that is 50 to 200, guys. 50 to 200 ml. For children 18 months to 5 years, that is 200 to 300 ml. And then for children 5 to 12 years old, that is 300 to 500 ml. 300 to 500 ml. Your quiz will be given tomorrow, so I'll give time to study kasi long quiz kayo tomorrow. Long quiz kayo tomorrow in the afternoon. I'll give you ample time to review. Mahaba ang quiz nyo kasi mahaba ang lecture ko, guys. Okay? And then, guys, hindi na pwedeng ibalik-balik ang question sa LMS. Kailangan masagutan mo before you proceed to the next. And of course, kailangan naka-online tayo. Okay? Para iwas cheating. Okay? Let's go. Letter D. It is used to clean the lower portion of the colon or the sigmoid colon. This is your low volume enema. This is your low volume enema. This is your small or low volume enema. Small volume enema or low volume enema. Okay? Small volume enema. It is used to clean the lower portion of the colon and the sigmoid. This type of cleansing enema is often used for the patient who is constipated but does not need cleansing of the higher colon. So, ibig sabihin, nasa rectum, nasa sigmoid colon lang yung fecal impaction. Pag sinabi mong fecal impaction, nandoon yung feces hindi makalabas. Okay? Hindi umuusad pababa, nandun lang siya. Okay? That's why gamitan natin ng low volume enema. The amount used is less than 500 ml. Less than 500 ml, particularly 90 to 120 ml. 90 to 120 ml. The height of administration is not more than 12 inches. Not more than 12 inches. Let's go. Number 2, tapos na tayo ng cleansing enema. Sa cleansing enema, 4 types yung cleansing enema natin. You have your high enema, you have your low enema, large volume enema and low or small volume enema. Naka-follow ba tayo, guys?
Sir.
Okay, please take down notes, ha? Please take down notes tayo. Okay, I think may mga may ano kayo. Walang messages, wala pa naman. Okay. Second type of enema tayo, mag-move on na tayo, tapos na tayo ng cleansing enema. Cleansing enema, apat yon: high volume, low volume, small volume, high enema, low enema, large volume, small volume, high enema, low enema. Number 2 type of your enema, major type of your enema, is what you call your retention enema. Your retention enema or Harish flush enema. Your retention enema, magsulat na ako. Ma dear, ma, work, kapag i-close mo ngayong bintana dito, matiktik ula na mo ton, ma dear. Yung bintana dito sa may di angin ko, mapanpandaga na mo ti whiteboard market. Whiteboard ka nagsakit mo. Okay, number 2 is what you call your retention enema. Your retention enema, otherwise known as your Harish flush enema. Okay, this is occasionally used to expel gas. Okay, to expel gas or to relieve your flatulence. To relieve your flatulence. This type of enema provides an alternating flow of enema solutions between 100 and 200 ml, between 100 or 200 ml, okay, into and out of the patient's sigmoid colon and rectum. Okay, so pag Harish flush or retention enema, okay, it is only about 100 to 200 ml, okay, into the sigmoid colon and rectum. The purpose is to stimulate peristalsis or the movement of the colon, to be able to keep the intestines moving and moving, okay, to propel food along the normal process. The process is repeated how many times na nagagawin itong retention enema or Harish flush enema? It's about 5 to 6 times. Guys, it is 5 to 6 times until the flatus is expelled, until the gas is expelled and abdominal distension is relieved. Okay? Agbubusog ti pasyentem ditoy. If everyone understands Ilocano, agbubusog. Kaya tayo mag-perform ng Harish flush or your retention enema. Ay, guys, sorry, non-retention ko na kuma. Anong sinabi ko? Non-retention. Sorry, non-retention. Number 2, non-retention enema. Okay. Number 3, this is your retention enema. Number 3, this is your retention enema. Okay. Number 3, this is your retention enema. Kaya siya non-retention, guys, kasi, okay, tatanggalin natin agad yung solution doon sa rectum and sigmoid. Hindi magtatagal. Unlike in your retention enema, which is your number 3, 3 hours yung solution na nandoon. 1.5 to 3 hours yung solution, it will stay in the colon for better cleansing effect. Kaya nga siya retention kasi mariretain yung solution doon sa bowel or sa colon ng pasyente for about 3 hours. In your non-retention enema, saglit lang yan. We will discuss, okay, we will make a summary later kung ilang minuto itong mga ito. Okay? Next type of oil, it introduces oil. Pag retention enema, guys, gumagamit tayo ng oil dito. Okay? Oil or medication into the rectum and sigmoid colon. There are 3 common types of oil and medications that given in your retention enema. Number 1 is what you call your antibiotic enema. as the name implies, antibiotic, we will be able to treat infections, to kill bacteria. Okay? To kill bacterial microorganisms. Kaya ang tawag sa kanya ay antibiotic enema. Next is antihelmintic. Okay? Antihelmintic. Antihelmintic enema to kill the parasites or to kill helminths such as worms and intestinal parasites. And the last type of enema is what you call your nutritive enema. Your nutritive enema to be able to administer fluids and nutrients to the rectum. Okay, to be able to administer fluids and nutrients to the rectum. Okay? I haven't seen this yet, pero it's a type of retention enema. Okay, ulitin natin, tatlo yan: antibiotic enema to kill microorganisms, antihelmintic enema to kill parasites, to be able to deliver food and nutrients to the rectum. You call it nutritive enema. Okay? Nasa retention enema pa rin tayo. The type of retention, nasabi ko na yan, it's 1.5 to 3 hours. That is 1 to 3 hours. In some books, 1 to 3 hours. The purpose is to soften the feces. Alam mo naman ang ibig sabihin ng soften. To lubricate the rectum and anal canal, thus facilitating the passage of the feces. For carminative enema, which we will discuss later on, gumagamit tayo ng 60 to 80 ml, 60 to 80 ml, okay, 60 to 80 ml. And then for the oil that is 90 to 120 ml. Okay, 90 to 120 ml. Basta pag oil guys, 90 to 120 ml. Pag carminative, that is 60 to 80. Okay, and the height is 18 inches above the anus. That is 18 inches. 18 ba? Retention. Okay, no. Pag non-retention, 18. Pag retention, 12 inches. Okay, final na. That is 12 inches above the anus. 12 inches above the anus. And the temperature is about 105 to 110 degrees Fahrenheit. 105 to 110 degrees Fahrenheit. 105 to 110 degrees Fahrenheit. Ulitin natin. Retention enema, 1 to 3 hours. In some books, 1.5 to 3 hours. Other solutions, these are types of retention enema. Number 1, carminative enema, 60 to 80 ml. For your oil enema, that is 90 to 120 ml. The height is 12 inches. Okay, and the temperature is 105 to 110 degrees Fahrenheit. Let's go. Okay, this is a special type of retention enema termed as your carminative enema. This is your carminative enema. Okay, paki-underline mo na lang yan to expel flatus. Okay, meaning the very purpose of carminative enema is to relieve gas, to remove or relieve gas. Okay? Kaya dito po, number 2, the solution instilled into the rectum releases gas. Okay, releases gas, which in turn distends the rectum and the colon, thus stimulating peristalsis. This type of enema allows waste and toxins. Paki-underline mo, this is also the purpose of your carminative enema, to relieve toxins and gas from the body, particularly from the colon. This is your carminative enema, a special type of your retention enema. Non-retention enema solutions, hypotonic. Okay, tap water. Okay, yung tap water lang, ordinary water, 500 to 1,000 ml. 500 to 1,000 ml. For your isotonic solution, okay, mamaya didiscuss natin anong ibig sabihin ng hypotonic, anong ibig sabihin ng isotonic, anong ibig sabihin ng hypertonic. You will get to understand later. Okay, i-summarize muna natin ito. For your non-retention enema, Okay, the solutions are for your hypotonic solution, tap water 500 to 1,000. For your isotonic solution, plain NSS ito, okay, 9 ml lang po, about 9 ml of sodium chloride to 1,000 ml of water. 9 ml of sodium chloride to 1,000 ml of water. For your soap suds, didiscuss natin ang soap suds mamaya, 20 ml of castile soap, okay, 20 ml of castile soap, 20 ml of castile soap, okay, to 500 or even 1,000 ml of water. 20 ml of castile soap, papakita ko mamaya itsura niya, in 500 to 1,000 ml of water. For your hypertonic solutions, split that is just about 90 to 120 ml. That is 90 to 120 ml. 90 to 120 ml. Okay? Non-retention, ang height nito, 18 inches. Okay? Kapag retention, 12 inches. You have to remember that. Kanina sa retention, ang temperature niya is 105 to 110. Ito naman po, 115, okay, to 125 degrees Fahrenheit. 115 to 125 degrees Fahrenheit. And then the time of retention is about 5 to 15 minutes. 5 to 15 minutes. Sa retention enema, ilang oras guys? Retention enema, ilang oras?
1 to 3 hours po.
1 to 3 hours. Oh, very good, Romel. For your non-retention enema, it is only 5 to 10 minutes. Okay. Next, we will discuss now the difference between hypertonic solution, hypotonic solution, and isotonic solution. Okay. Letter A is your hypertonic solution. Pag sinabi mong hypertonic solution, itong solution na to, mataas ang kanyang solute concentration. Mataas ang kanyang solute concentration. Pag nakita mo yung solute, isipin mo na lang yung mga asin, yung mga sugar, ganyan, pag solute, di ba? Pag solute yan, kaya pag solute, isipin mo, these are your electrolytes, guys. These are your electrolytes, like your magnesium, your sodium, your potassium, your calcium, okay, your phosphorus. These are your solutes. Okay? So, ibig sabihin, yung solution, mas mataas ang kanyang solute concentration than yung cell sa ating katawan. Okay? Example, paano yung tsura niyan, guys? This is your hypertonic solution. And this is your cell. Okay. Oh, dito na lang. And they are separated by, okay, yan, a semi-permeable membrane. Okay. This is your ECF. This is your ICF. Cells ito. Ito yung plasma natin. Ito yung blood. Ito yung plasma natin. Okay? So, ibig sabihin daw guys, yung cell natin, kokonti lang, low ang kanyang solute. Mababa ang kanyang solute concentration. Mababa ang kanyang solute concentration. Mababa dito ang sodium, mababa ang glucose, mababa ang electrolytes, phosphorus, ganun. Dito sa ECF, yung solution natin, hypertonic. Ibig sabihin, dito ang mas